Recording in progress. Good morning, honorable members. Good morning, DM, as well as the officials from the department, from Parliament, as well as the secretary of the committee and the officials of the committee. I think we are quorum, so we can start. Honorable members, DM, as well as all other officials, you are welcome to the Select Committee on Social Services. And Marcel, I will request you to please flag the agenda, because I think the only item we have is the APP of the Central Drug Authority, as well as the plan, the master plan. So, honorable members, DM, you are more than welcome to the committee. So, in front of us, we have the agenda. Honorable members, can I get a mover for the adoption of the agenda?
Chairperson.
Yes, Honorable Makwele.
No. Thanks very much, Chair. And greetings to honorable members, officials from the department. Chair, without much ado, I rise to support the agenda as presented before us. And thanks very much, Chair.
Thank you, Honorable Makwele. The next point, can we get a seconder for the adoption of the agenda? Yes.
I move to second the adoption of the minutes.
Thank you, Honorable Adrianse. So that the agenda is adopted. So the next point on the agenda is the apologies. Marcia, can we get the apologies?
Good morning, Chairperson and members, Deputy Minister, as well as the Chairperson of the CDA and colleagues. Chairperson, we received an apology from the Minister who is currently on leave, as well as Member Breed. She's currently on an oversight with another committee. Thank you, Chair.
Thank you, Marcial. Honorable members, can we get a mover for the adoption of the apologies? Honorable Du Plessis.
Thank you, Chair. I move to adopt the apologies.
Thank you, Honorable Du Plessis. Honorable Adrianse.
I move to second the adoption of the apologies. Thank you, Chairperson.
Thank you, Honorable Adrianse. So the next agenda point, DM, is the APP as well as the master plan of the Central Drug Authority. Over to you, DM.
Honorable Chairperson, members of the Select Committee on Social Services, esteemed colleagues, distinguished guests, a very good morning to you. It is my privilege to introduce the Central Drug Authority, CDA, as they present their 2023-2024 annual report. The CDA plays a crucial role in South Africa's ongoing efforts to combat harmful substance use and illicit drug trafficking. Established under the Prevention and Treatment for Harmful Substance Use Act number 70 of 2008, the CDA is mandated to oversee and coordinate the implementation of the National Drug Master Plan. Honorable Chairperson, oversee and coordinate, but they do more and they want to do more. Doing more requires budgetary line items which DSD may not have. However, it is my delegation, drugs, and I want stronger oversight and I want coordination, but I need, and I'm going to get legal advice to advise what coordination involves. And I would also like your select committee to give guidance and speak on this matter. The new 5-year drug master plan under my delegation, Honourable Chair, will have to focus on prevention. The class of 2025 and 2029, that is the babies born in 2025, and children that is still around in 2029, must be a new generation free of drugs because of our prevention strategies. And here I need the support of this select committee and honourable members of parliament. The 5-year plan that we need to put in place must be the new way of governing for South Africa, and that is one plan to do away with silos. And as you know, we eventually want to have one tier of government in the next phase of the National Development Plan. So we need to start now with the district development model when it comes to developing the new 5-year drug master plan. Now, let me explain, Honourable Chair. At the moment, we have the Central Drug Authority with its own act, and which you have welcomed today. We also have the DSD Directorate, and some of them are also here today. Then we have local action drug committees, which is the constitutional mandate of mayors, who must also provide resources and fund them. So we start with the streets. The mayor represents the streets. The streets are represented on this action group. But, Honourable Chair, I have to give you very sad news. Only 10% of mayors comply by forming local action drug committees. So our mayors in South Africa, with the exceptions I mentioned, are killing the heart of the 5-year drug master plan. By not forming these committees, they're sabotaging the drug master plan. So we also have provincial units, 9 of them, that have budgets and have to deal with substance abuse. And while I'm talking about the provincial units, later on we will hear that the term of office of the Central Drug Committee will terminate, come to an end, and we need the Premier and the MECs and the provincial governments to nominate members to serve on the Central Drug Committee. And also, I would imagine honourable members on this select committee will also apply their mind in this regard. Then we also have NGOs and NPOs. Now, I will make a very controversial statement. I will not support these frontline service providers if they do not exceed 75% of their funds, resources, and manpower on prevention. Those who are on drugs and have crossed the Rubicon, that is a lost cause. And I can tell you that a Minister of Health who knows about these things will support me that we're wasting our time. Once you're on drugs and you're a drug addict, you've crossed the Rubicon. So we have to decide: are we gonna focus on those who are on drugs and who are drug addicts, or are we going to start preventing the class of 2005 babies that are born for the next 5 years at this drug master plan? Are we going to start focusing on prevention? Chair, we need one plan, one budget for all the above stakeholders in line with the district development model. We cannot have so many silos, and that's why we've made absolutely no progress over the last 10 years when it comes to combating substance abuse and drug trafficking. Let me tell you, I've heard from honorable cabinet ministers, I've heard from previous ministers, we've made absolutely no progress. That is a blot on all of us. The CDA's 2023-24 annual report was tabled at the National Assembly on the 13th of March 2025 by the Portfolio Committee on Social Development, and the report was subsequently adopted with 2 recommendations. First, the establishment of an interministerial committee to enhance coordination and accountability in addressing harmful substance abuse across government. Secondly, the Minister of Social Development should engage the National Treasury towards a sustainable funding solution for the CDA to ensure it has the necessary resources to fulfill its mandate effectively. It is also important to note that the term of the current CDA board will expire at the end of 2026. As the board enters its final year in office, it is critical to ensure that its last year is impactful by providing all the necessary support required for the CDA to perform its role and responsibilities, as reflected in the provisions of Act 70 of 2008. This includes strengthening the CDA's oversight function, in ensuring its ability to coordinate effectively, and addressing challenges such as underfunding and interdepartmental collaboration. Honorable Chair, I was shocked when I heard that the CDA was told to stop all activities that involves money for the month of March. We threw a whole month into the waste paper basket, and that is not in the spirit of the Act, and it is a blot on those responsible for stopping the CDA from engaging in any activities that requires funding, like paying for airfares and hotels for a whole month. That is not acceptable. Furthermore, the NDMP 2002-19-2004 has now expired, having been launched on the 26th of June 2020 during the commemoration of International Day Against Drug Abuse and Illicit Trafficking, also known as World Drug Day. A new National Drug Master Plan for 2025 to 2030 that will help the class that I referred to earlier on to be drug-free is currently under development and is expected to be launched this financial year. This new strategy must build on past lessons while responding to emerging challenges in harmful substance use prevention, treatment, harm reduction, and law enforcement. It is imperative that all stakeholders contribute meaningfully to this process to ensure the next National Drug Master Plan is robust, well-resourced, and capable of making a real difference in communities affected by harmful substance use. I hope to hear quite a lot from this select committee, some input into this 5-year Drug Master Plan. As the committee engages with this report, I urge us all to critically assess how we can strengthen the CDA's oversight role, enhance its operational capacity, so it is not told to go to sleep for a whole month, and ensure that the fight against harmful substance use remains a national priority. I trust that this discussion will yield constructive insights that will support the continued refinement of policies and strategies aimed at creating a South Africa free from the surge of harmful substance use. Chair, please, the magic words is one plan, one budget. With that, I now invite, with your permission, Honourable Chair, the CDA to present their 2023-2024 annual report. I thank you.
They may proceed, DM.
Okay. Thank you very, very much, Honorable Chairperson of the Select Committee. And thank you very much to the Deputy Minister for the introduction. And we will then proceed with the presentation. It is a presentation of the annual report for 2023-24 to the Select Committee on Social Services. We will then continue. And the next slide basically looks at what the Minister has said, this really remains a big challenge, a pervasive challenge in the community, in our society, and that it threatens the existence, the survival, and the security of communities, and that it also threatens the livelihoods and well-being of the individuals and families in our society. So in the interest of time, Chair, I will just jump all the other slides and move directly into the slide on the powers and duties of the CDA. It's important also just to say that currently we are 9 members, plus 20 members of the departments, 32. The 9 members have been appointed by the Minister from civil society, and they are not employees of government. And then the 20 are representatives from the 20 departments that are highlighted in the Act of Prevention of and Treatment for Substance Abuse in the country. But right now, we have 16 departments that continue to participate in the work of the CDA. So the powers and functions of the CDA is that we, as a collective, as the board, we monitor and we oversee the implementation of the National Drug Master Plan. So we don't implement it as a board of the CDA, but we monitor its implementation, and the departments, together with other stakeholders, are the ones who are expected to implement the National Drug Master Plan. There are instances in Goal 5 and Goal 6 where the CDA has some role to play in as far as the National Drug Master Plan. We facilitate and encourage the coordination of projects, strategic projects. We rationalize and monitor the utilization of the resources that are meant to, address the situation. We are supposed to encourage the departments to have the drug master plans, to have the indicators, to address this situation, this pandemic. We also are expected to establish and maintain information systems. We are expected to submit an annual report, and we are happy to say that we have been submitting annual reports since the inception of the board in 2021. Hence, we are now reporting on 2023-24. We should ensure the development of prevention, early intervention, aftercare strategies, and we're happy to say that indeed the Department of Social Development, as the custodian of the Act, has these strategies in place, and the other departments therefore would have strategies that pertain to their mandate. We should prioritize strategies that prevent HIV and other medical consequences, related to substance abuse. And yes, these are in place, and in particular, it is the health department that is then responsible for the HIV and other medical consequences strategies. We advise government on policies and programs related to substance abuse and drug trafficking. We also review and we have been advising government on a few policies and programs. We then review the National Drug Master Plan every 5 years, and the Deputy Minister has spoken to this particular matter. Currently, it is being reviewed. And then we have to organize a national summit every 2 years. And indeed, that has been done. The first summit has been held in 2023, and the second summit will be held towards the end of 2025. We then are expected to perform other ministerial mandates, and so far we haven't received any further ministerial mandates. If we can continue to the next slide, which basically talks about the National Drug Master Plan in terms of the vision. It's about a South Africa free of substance abuse, and the mission is to ensure that we embraced a balanced, integrated, and evidence-based approach to this pandemic, that we invest in building safe communities, that we control the demand for and supply of substances, harmful substances, and that we effectively control substances for therapeutic use and the emergence of new psychoactive substances. We coordinate and deliver effective government prevention interventions. We combat, this is some of the language that we are going to amend with the new National Drug Master Plan, because we are no longer talking about war against drugs. Yes, we talk about arrest and prosecution of drug dealers, but in terms of users, we're not fighting with them. We must ensure that they receive a treatment. And then in terms of the target population, we are expected, and we have been working with the young people who are inside and outside of school, the children, the women, including pregnant women, the people with disabilities, occupational groups such as the risk key populations, as well as prison population, sex workers, and people who inject and use drugs. And then in terms of the principles that we adhere to as a collective, is that we must adhere to the human rights principles. We must be inclusive and participatory in our response. We must adhere to evidence-based programs, people-centered and multi-sectoral and multilateral in nature, so that we avoid the silos that the Deputy Minister was talking about. The National Drug Master Plan has 7 goals. The first one is demand reduction through prevention and treatment. The second one is about supply reduction through effective law enforcement and countering money laundering. The third one is control of drugs intended for medical use. The fourth is identification and control of new psychoactive substances. The fifth is governance, leadership, and accountability. The sixth one is strengthening data collection, monitoring and evaluation and research. And the seventh one is stimulating robust and sustainable economic growth aimed at reducing poverty, unemployment, and inequalities. And the next slide then looks at the situational analysis as to what exactly is happening globally in Africa and in South Africa. So we all know that this is a worldwide phenomenon. Drug use, drug abuse, illicit trafficking happens everywhere in the world. But when we look at South Africa, we're facing challenges in terms of illegal drug markets, with cannabis, with meth, which is known as TIC, with heroin, with cocaine being the most prominent. And then we depend on the data from Sakendu, which is an organization that works with the Department of Health to collect data from the treatment centers. And they're the ones who are indicating to us that in as much as a lot of work is being done in our country, the problem of drug use, abuse, and illicit trafficking is persistent. And in the main, in our country, we have a challenge of cannabis and alcohol use, which is increasing since decriminalization of 2018. I think with the Concord decision, people thought that it's a free and all. People can use cannabis as they want, whereas it's specifically for private use and for adults as well. And the issue of alcohol is really a big problem in our country, especially binge drinking, which contributes to other social ills, the gender-based violence, the domestic violence, the underage drinking, the health complications of people, the issue of the fetal alcohol spectrum, because we've seen women who are still drinking alcohol, and when the children are born, they are born with this syndrome. And I've already spoken about the cannabis here. We're just talking about the methods of production, the entry into South Africa as well. It's cannabis is majorly produced in Eastern Cape and KwaZulu-Natal, and it's trafficked cross-border from the neighboring countries, Lesotho and Swatini, but it's also trafficked from our country as well. The methamphetamine, it's a precursor chemical, which is smuggled in various sources, primarily produced in the Western Cape, and it's also trafficked from Southeast Asia and the West. The heroin is consumed domestically and further trafficked to other countries. It is trafficked from Afghanistan via East Africa and Southern Africa. Cocaine is smuggled into the country from various countries such as Brazil and Colombia, and it enters through the entry points, Port of Durban in particular, in the marine routes, and it enters from mainly from the Latin Americas. The synthetic drugs, which is now becoming a main challenge in the world, and as a country, if we don't deal with it now, it will be a big problem. Right now, I think it's greatly found in America. It's major trafficked in various traffic routes into South Africa via postal services and courier methods as well. And the key challenges is that the complex trafficking networks are in terms of the porous borders in our country and the high demand in urban areas and the limited law enforcement. As long as there's high demand, there will be high supply of drugs. We can move to the next slide, which then talks about, it continues to talk about the situation in the country, looking at tobacco, which has also become a challenge, even though it is legal, people can use it in our country, but we are informed that 18 to 20% of adults in the country are smoking, tobacco, and with high rates amongst men. The emerging trends, which are also worrisome in our country, is the hookah, the water pipe. And people think that hookah is less harmful than cigarette, whereas we have heard stories that there are young people who have died because of abuse of the hookah pipe. And that's the case because it really poses significant health risks in the population. We're working with cancer, who has raised concerns about these risks that we need to deal with. And that's why the Department of Health, working together with us, are now looking at the laws so that there can be regulations that regulate hookah use, the lounges that are being used by young people who are using flavored tobacco products. And then vaping has also become a challenge. That is the e-cigarettes, which is rapidly growing amongst young people as well. It's marketed by the industry as a safe alternative, whereas it is not safe at all. There's a potential nicotine addiction and harmful substances in the e-liquids. And when the Department of Health is looking at the amendment of the regulations and the laws, they will definitely be looking into this challenge and look into some of the solutions that we have advanced as the CDA. We can move in the interest of time, just to move very quickly. Maybe let's move away from cannabis because I think we've spoken about it. What is important is that we have the health department working with SAPRA, who's therefore looking at this challenge and beginning to also amend the laws and the policies in as far as this is concerned. We can move on to the next slide, which is then talking about what are we saying? What have we said as the CDA? Having looked at the situational analysis, we as a CDA, we said there should be intensification of education and prevention programs. And I think this is what the Deputy Minister was saying earlier on. And this must be evidence-based education and prevention programs. Not that there hasn't been any of this work happening. There has been, but in terms of the impact, we see very little impact because many young people continue use and abuse cannabis, alcohol as well. And then we've also advised government to expand community-based harm reduction with the introduction of the opioid substitution therapy, because there are people who are injecting drugs in our communities, and and it's heroin in particular. When they inject heroin, they share the needles, and then they are also sharing the illnesses such as hepatitis C, HIV. So that's why the opioid substitution therapy is very important for it to be introduced in the public health centers. Right now, it's only done by the non-governmental organizations, and we have advised government that as government, we need to fund this program. We've advised also government, led by SAPS, that there should be enforcement, there should be enhancement of law enforcement to address the trafficking networks and to reduce the availability of drugs in our country, but also working together with the Border Management Authority, with the Home Affairs and other departments. The border controls should be strengthened, and then intelligence as well should be strengthened, and that there should be further cooperation with SADC, with the continent, as well as with the world. And then in terms of the regulatory reforms, we've also advised government for stricter regulations in alcohol use, and hence the Liquor Amendment Bill is being amended, but our concern is that it has been tabled in 2016, and there is a need for urgency for it to be, to be expedited and to be addressed by Parliament and NCOP. The next slide then talks about the stakeholder collaboration. Just to say that as the CDA, we don't work alone. We work with various organizations, such as the non-governmental organizations, the organizations that work on policy, not only in South Africa, but we work with African Union, we work with the countries, the BRICS organizations, and we work with the United Nations organizations, such as the UNODC and CND. We work with the World Health Organization, and all this work is geared towards addressing the challenge, the huge challenge of drug use, drug abuse, and illicit trafficking in our country. So we will continue collaborating, because the minister keeps on telling us, Deputy Minister, that we must do away with silo mentality. And then I think let's jump this slide as Deputy Chair, so that we speed up the process. We want to report to the Select Committee that, as I've indicated earlier, we have about 20 departments that are supposed to be members of the CDA, and we don't have all of them at the same time. Sorry about that. We don't have all of them at the same time. We have about 16 of them who are consistent in terms of attending at a time. And then about 4 of them have never bothered. 4 departments of this government have never really bothered to participate in the CDA, and they've never really bothered to submit their reports. But some departments and like the correctional services have submitted, but they submitted very, very late. So their report was not considered. As the Deputy Minister has indicated, we have 9 provincial substance abuse forums. They've all reported, except that 2 of them have reported very late. We now want to get into the actual work that has been done in terms of the 7 goals of the National Drug Master Plan, and we'll try and summarize. The first one being the drug demand reduction. These are the departments that have really done some work in the communities, and they've reported to us. They've done work in as far as prevention and awareness campaigns in the communities, and the major project being Gimoja, which is addressing drug abuse and alcohol abuse amongst the young people. And it's actually done by young people themselves. So young people listen to young people better than they listen to the adults. But we also want to indicate that there is treatment. There's about 12 public treatment centers in the country. And we do have quite a number of users of drugs and alcohol abusers who are who are getting treatment from these treatment centers. But we are aware of some treatment centers that are not functional, the one in the Free State in particular, and we are addressing that particular situation, that we can't have a state-of-the-art treatment center in the Free State, and it's named after a stalwart of fighting for freedom, Mayor Charlotte Maxeke, and yet it's not effectively being used, and people are not getting services. And we then continue then to work in terms of capacitating the departments, so that departments must produce the drug master plans, the sector drug master plans, and the DM is encouraging one plan and one budget, and that's what we are going to be looking at when we are reviewing the National Drug Master Plan. Let me not really go through each and every work that is done, because drug demand is really about education of communities, intensifying awareness programs, but ensuring that our people have access to treatment. And in as far as supply reduction is concerned, we have these few departments, trade, industry and competition, justice, as well as COGTA, who've been doing some great work. Also, they've conducted workshops with communities in the schools, with traditional leaders, and they've done capacity building programs with communities. They work with the gambling board, the liquor boards, etc., just for them to work together to ensure that we minimize the abuse of alcohol and drugs in the community. The South African police have been hard at work as well in terms of, again, creating awareness and having forensic sessions in terms of the drugs themselves. And they've been acquiring forensic evidence that has been processed through the laboratories. And they've also been hard at work in terms of organized crime and addressing the syndicates, arresting those syndicates. But our question as CDA has been, once we have arrested the syndicates and the drug dealers, what happens? Then we were told that in this year under review, actually the prosecution, the conviction rates have gone up to about 96%. But the challenge, as we know, that on a regular basis, there are drug busts that are happening. So it means that the supply of drugs continues to happen in our country. But they've also been busy with crime intelligence operations. There is border control and visible policing that is happening. But we have indicated that more and more of that needs to happen because of the porous borders. They've been able to profile the vehicles and the containers and the cargo that is actually carrying these illicit drugs into our country. They've been able to dismantle the clandestine laboratories, but on a regular basis, these are actually found. But those that are found are arrested and they are prosecuted. Mainly, they are manufacturing meth. They are manufacturing dahaman drugs, crystal meth, which is very dangerous to young people in particular. But they've also been seizing, rather forfeiting the assets of the drug traffickers and the drug dealers, and dealing with the money laundering that is happening in our country. And they have been enforcing liquor laws by inspecting the liquor outlets and arresting those that are involved in illicit selling of illegal substances. And we can continue to the next slide, which is now about goal 3, availability of substance for medication and for scientific use. Here we are led by the Department of Health, working with SAPRA in terms of conducting research on the capacity of selected health facilities to provide the OST that I spoke about earlier on. But SAPRA has been employing people because one of the things that the National Drug Master Plan encourages is employment of people with the skills that are required to control the work that is done, especially in the ports of entry. And therefore, SAPRA has done that. And then they are also responsible for importation and exportation of narcotics and the new psychoactive drugs. They also, amend the schedule of medicines from time to time. So we were reported that indeed the sale of codeine is being monitored as well, because codeine is used by the young people to really manufacture the drugs in the streets, and that SAPRA is addressing that particular issue. And then on goal number 4, again led by the South African police, who continue to identify the new psychoactive substances, and I've indicated what these substances are earlier on. And we have been working with the USA in terms of the Global Coalition to Address Synthetic Drugs Threat, and SAPS has been leading this process, but the Ministry of Social Development has been part of these processes as well. And there's collaboration with SARS and transport in as far as identification of these new psychoactive substances are concerned. There has been international relations and cooperation. I think I've indicated that we are working very closely with the African Union, the UNODC, and then we also are working with various agencies like the heads of National Law Enforcement Agency of Africa, led by DERCO. And then also, this is just a slide that indicates the work that SARS has done in terms of seizing the narcotics, all the illegal substances, and I think we mentioned all the substances that are being seized by SARS. And then we go very, very briefly to the work of governance, and this is about goal 5 of the National Drug Master Plan. We want to say that the CDA is functional. It's got the chairperson and the deputy chair who were appointed. It's got the executive committee that is very functional, and it's got the portfolio committees, about 5 of those portfolio committees that are also functional. We've got the general committee, which is functional, which meets once a quarter. The general committee is basically the board of the CDA. The extended general meeting, then we extend the meetings to the other external stakeholders, the civil society organizations, the faith-based organizations, the private business are also invited to these meetings so that they can share with us what they are doing to address this challenge. The 9 provincial substance abuse forum has been established, but one of them is very, very weak, and we are trying to help them to resuscitate it. The deputy minister has reported that the biggest weakness in our country is the local drug action committees. Only 118 of them, of the 257 in our country, have been formed. That's supposed to be formed by the mayors and supported by the mayors. And the deputy minister has committed to the CDA that he will be working with us to reach out to the mayors and remind them of their statutory responsibility. The challenge we have in the governance is the secretariat, that we only have 2 deputy directors that are supporting the CDA, and that's not enough. The work is too much for only 2 people, and then the other 2 are basically administrative people. So this is the challenge that we've been talking to the department, where we are hosted as the CDA, and the deputy minister has been hard at work to address this situation for the CDA. And then just in continuation of governance and accountability, we have capacitated departments, and only 6 of them have the drug master plans. So we have continuously said that all the other departments must have the drug master plans. We have key stakeholders that are participating in the CDA. We've indicated the 4 departments that are not participating. We've indicated the need for the national harm reduction strategy, so that we reduce the harms caused by injection of drugs, and this must be in line with the international standards. And we've also called for a supply reduction strategy, so that really the supply of drugs should be reduced in our country, but there should be coordination, working together and dealing away with silos that the deputy minister spoke about. And the prevention strategy, there must be one prevention strategy, and that's why the National Drug Master Plan is being revised, so that there's one prevention strategy and all the departments are informed by the strategy. And continuing, I think we should really jump this slide, because we've really, I think we've reported on goal 5 extensively, and we should move on to goal number 6, which is about research, development, monitoring, and evaluation. So there are departments that do a bit of data collection and research so that we know the extent of drug use and drug abuse in the country, as well as illicit trafficking. We've seen social development also briefing not only South Africa, but briefing the AU and briefing the World, the UNODC in terms of the World Drug Report. Hence, when you read the World Drug Report and the Payendu, which is an African report, you'll see that there is some data from South Africa. The justice and constitutional development they really have a responsibility to track the usage of drugs by the children, and they've been able to report to the CDA, and it is concerning that we have children as young as the age of 13, 14, 15 who are really using drugs, and they're in conflict with the law, and that's why they have to be diverted. They are diverted, and they are kept in the child and youth care centers, where they are then taught about the dangers of drugs and that they should not continue with this situation. As a Central Drug Authority, I think the most important point here is that we are expected to do a national prevalence survey so that we know exactly how the whole country, what the extent of the whole country is in terms of drug use and abuse, also the illicit drug trafficking. But because of shortage of a budget, we haven't been able to do that, but we've relied on other research organizations. We've been receiving data from them, but we believe that the national prevalence data is actually critical, and the Deputy Minister has also committed to work with us to ensure that we definitely have a national prevalence survey as a country. Let's move on. So with economic development, it being the last goal of the National Drug Master Plan, we have received reports from all the 9 provincial substance abuse forum, but we have not received reports from all the departments that are responsible for poverty alleviation or poverty reduction and unemployment reduction of inequality as well. We do not know what they are doing, even though generally we read from the newspapers that there is some work that is happening, but we would like to get reports as the CDA, but we are not getting those reports. But we only have one report from the Department of Social Development, which is implementing the anti-gangsterism strategy, because many young people are involved in gangsterism, and therefore they are addressing the high risk. So we would like the Select Committee also to assist us going forward to ensure that all the economic cluster departments really report to the CDA so that the nation and Parliament and NCOP can know what exactly is being done and what impact are we making. And the Deputy Minister has been saying that we need to see impact. We can't be doing so much work and yet the challenge of substance use and illicit trafficking in the country persists, and it's now becoming a national crisis. I'm going to hand over to the Deputy Chair to take care of the budget and the remaining few issues. Thank you.
Very much, Chair, and good morning to the Select Committee. Good morning, Chair, good morning, DM, and everyone on the call. I'm going to switch off my video now that I've greeted so that I can continue. The next part of there's going to be the analysis of the achievements, which comes with the key recommendations that we have made in this particular report. And we are saying, in terms of analyzing the departments and what they have done, we are saying we need to strengthen interdepartmental collaboration. That is, we need to require all departments to submit and implement sector plans. As the chairperson has said of the CDA, each department and entity that is a part of the Central Drug Authority has to develop its own departmental drug master plan. And that is the plan that it has to align with the National Drug Master Plan. And each department then implements that departmental drug master plan. And all the departments that are represented in the CDA must have their own. And this is the recommendation that we are making to say, can we just ensure that all the departments have those sector master plans? And then we need to increase CDA oversight and funding. That is to ring fence CDA's budget, expand so as to expand also research capacity. We need to expand prevention and harm reduction programs. The DM has spoken about the issue of prevention, and we are also strongly emphasizing that there needs to be a very, very strong prevention campaign that the country goes on. We need to boost data collection and monitoring. We need that prevalence survey on drug use trends, because currently, as the chair has mentioned, we are using data from Sakendo, which is only focused on treatment, on data that is received from treatment centers. We need to tighten law enforcement and border security. We need to leverage the economic development, and moving on then to the PSAFs. The chairperson, you mentioned that we've got the 9 provincial substance abuse forums, and of those 9 provincial substance abuse forums, 1, which is the Northern Cape, is currently needing a lot of support to resuscitate it and get it to function well. And that is something that we are doing. Slide 36 to slide 39 is basically on drug demand reduction efforts of all the provincial substance abuse forums. And what has been the focus of all of them is prevention, awareness, interventions, which are led in the main by the Department of Social Development at provincial level. And then also with other stakeholders, that civil society organizations in those provinces that have been supporting and working with the department to do that work. We've got the training of officials in the Department of Social Development, as well as other departments that are involved in prevention programs and interventions, as well as other stakeholders, as previously mentioned. And then a few provinces engage with harm reduction NGOs, like the province of KwaZulu-Natal. That is one of the provinces that also support, or rather work with the NGOs that are providing harm reduction services. We do know as well that Gauteng is also working with COSAP in Tshwane to ensure that those services are provided, as well as the other NGOs that are in the country. All PSAFs reported on this goal, but the Gauteng province and Northwest reports were submitted late. And because of that, they will not be reflected in this presentation. And moving on to supply reduction, which is slide number 40 to number 43, we've got all PSAFs reporting on this one. And the main thing was illegal liquor trade, which has been identified as a major challenge. SAPS has been issuing fines, but there's also a challenge with the liquor boards in that they do not have the capacity to enforce the regulations in each of the provinces. And this is something that needs to be looked at, because for as long as there's regulations that are not being enforced, then we continue to have a problem. We continue to have illicit and illegal establishments and taverns operating. But this is a major challenge in our communities, because we see then a proliferation of taverns that are and shebins that operate even in areas that they're not supposed to be operating in, near schools and near churches. And just to mention that the Eastern Cape Liquor Board has reviewed their legislation or their regulation, and from the 1st of March, those regulations were in place, which do not allow for liquor to be sold near churches and near schools. And this, of course, is already getting a bit of pushback, but that is something that is to be expected. There's crime prevention and awareness programs that are being implemented by the PSAFs, and schools are linked to police stations, and that is something that we are commending as the CDA. Slides number 44 is on new identification of new psychoactive and new psychotropic substances. PSAFs or provinces do not implement goal number 3, because that is a competency at national level. So they do not even report on the implementation of goal number 3. On goal number 4, we've got the two provinces that are reported to the CDA on this, which is the Eastern Cape and the Western Cape. And this is a bit of a challenge, because then that means we are not able to have real time or quick information of what is happening on the ground. And the new psychoactive and new psychotropic substances, they come from the local drug action, from the communities themselves, the municipalities. So we do need to push for more reporting on this one. And regarding governance and accountability, all the provinces reported, all the provinces engaged very, very well with the Central Drug Authority. And just to mention that the Gauteng province is currently in the process of appointing a new provincial substance abuse forum. And we are trusting, because they have engaged with the Central Drug Authority, that that appointment is going to be happening very soon. And the PSAFs all have indicated a challenge with human and financial resources to ensure that they are able to do their work. And if we can possibly get that sorted, maybe there can be better implementation of the National Drug Master Plan, or rather their provincial drug master plans. And the PSAFs have actually been quite good in developing their provincial drug master plans with the assistance of the CDA, particularly the Secretariat. And then on goal number 6, which is slide number 46, we have 5 PSAFs, which reported on that, which is the Eastern Cape, KZN, Free State, Mpumalanga, and the Western Cape. And on that one, just a few highlights would be in KZN. When we came into office, we went on an oversight visits to treatment centers, and we find that in Kanyani Treatment Center in Newcastle, they had a challenge with registration which had not been finalized. And we are glad to report now that that registration was finalized in 2023 with the assistance of the PSAF assisting the department as well as the center itself. And then in the Western Cape, one of the highlights is that the LDECs in the Western Cape, they submit their own reports. So the report that we receive as a Central Drug Authority from the Western Cape is quite bulky. And the reason for this is because the LDECs, each of the LDECs that are functional, they send through their report to the PSAF, and the PSAF consolidates all those reports and they are submitted to the Central Drug Authority. This is a show of functionality, because the other provinces, the challenge that we have is we hear that there's the 118 local drug action committees, but we do not actually know of those 118 which are functional. And because we do not receive or see those reports that are coming from the LDECs, we then are not sure in terms of the functionality, or is this work that is being done in a different way than what should be regarding the implementation of the Provincial Drug Master Plan. Mpumalanga is another province that we need to highlight on goal number 6, in that they have developed a database of registered and unregistered facilities, which is really good, because then in Mpumalanga, they are able to know where are the registered facilities, and then they are also able, even as the Provincial Department of Social Development, to then assist those that are not registered properly. And goal number 7, which is the economic development goal, 6 PSAFs submitted reports on this. The economic cluster departments at provincial level must engage with the PSAF and understand how their work impacts on the work of the province regarding issues of substance use prevention. And we also need to encourage the NYDA, even at provincial level. They need to be part of the PSAF, because there's a lot of work that the National Youth Development Agency is doing at provincial level, but it's not feeding in to the work of the provincial substance abuse forums. And then just to move on to focus on local drug action committees, as the chair has indicated, we've got 118, which is really a challenge. And in terms of analysis of PSAF implementation of NDMP, we are putting forward these recommendations, which is to standardize prevention programs. Programs must align with UNODC and WHO standards. And the Kimoja program is an evidence-based, scientific evidence-based program that has been tested. And what we are saying as a Central Drug Authority is that's probably the program that we should be implementing and focusing on as a country, instead of having other programs that are being implemented that may not necessarily be scientific evidence-based. Whereas the current program that the DSD has developed is actually is aligned to the UNODC and WHO standards. We need to enhance stakeholder participation. This is around improving the reporting of departments, but also to bring in all the other stakeholders in the country that are working on programs and implementing programs at provincial level, as well as at the level of national, and that would be at the level of the Central Drug Authority. This is work that we have started and we are pushing forward on. Focus on harm reduction. I will not focus on that myself because the chairperson has mentioned it. The interdepartmental and stakeholder collaboration, we need to strengthen that. And as the DM has said, we need to cut the silos. The silos are not taking us anywhere. Instead, they are really impeding our movement. And we are not going to be able to to reach the goal that we want to reach, for as long as we insist that we are going to work in silos. And then the addressing of illegal treatment centers, that is something that we need to do, which Mpumalanga is already working on. We need to increase public awareness. This one is a big one, and it's what the DM has also been mentioning in terms of the prevention programs. And then in terms of the local drug action committees, I'm going to just zone in on the key recommendation, which is to establish and functionalize the LDACs by engaging mayors, and the DM has indicated that that's something that he is intent on getting moving and moving fast on. He already indicated that he's already started engaging mayors, which we truly appreciate. We need to strengthen coordination and communication. PSAFs need to enhance their engagement and support of LDACs. And we do not want a situation where we have a PSAF that holds meetings for the sake of having meetings, but then in terms of trickling down to local level, it's not happening. So we need to find a way to ensure that the PSAFs are engaging meaningfully with the LDACs and they are supporting them. And those LDACs are functioning at community level, because for as long as the LDACs are not working, there is absolutely nothing that is going to move in the community. So we need to strengthen LDACs, and all resources and every effort has to be put towards ensuring that all LDACs work. We need to increase community engagement. We need to ensure LDACs maintain continuous outreach in communities. What we are saying on this one is the LDACs cannot be an LDAC for the sake of having a name that's called LDAC. They need to be known in their communities. So every municipality and every district municipality must know who the LDAC is, who is responsible, what are they doing, what are their programs, and the communities need to be in touch with those LDACs. And on this slide, we are talking about human resources and organizational environment. The DM has indicated the challenges that the CDA has had. And these challenges, Chairperson of the Select Committee, are not new challenges. These challenges have been here for a very long time. As the first would be the CDA director that has never been appointed, whereas the Act is quite clear on how the CDA should be functioning. We understand that there's challenges with finances, but it cannot be that the challenges have existed since the promulgation of the Act, which is 2008 to date. We are how many years down the line now? And we're still talking about the same challenges. And every annual report of the CDA has mentioned this challenge. And then the issue of the secretariat support, which the chair has also already mentioned, that we've got the 2 deputy directors. I'm not going to get into that. And then the blurred reporting and communicating lines between the secretariat, CDA, and DSD. This one is also a challenge, because the current secretariat that we have, they report direct to the DSD. They do not report to the CDA, which then is always just a challenge. And it's not the making of anybody in really. It's just that the fact that there is no clarity in terms of then who do they report to. And also the placement of the CDA, because the CDA is now seen as subsumed under the Anti-Substance Abuse Directorate, whereas it's supposed to be reporting direct to the minister. And that's something that needs to be sorted. And then the organizational environment, the CDA is an extra structure, and it should serve the whole nation and not be limited to the mandate of just the department, but to the overall mandate of Act number 2008, Act 70 of 2008, as well as the National Drug Master Plan. And the CDA's mandate is to support, coordinate, monitor, and oversee the implementation of the NDMP by government departments, entities, and stakeholders. So everybody, that's the responsibility of the CDA. And coming to the budget of the CDA, we had a budget in the 2023-24 financial year of 7.1 million, and we did overspend on that one. But the issues of the over expenditure are explained, and those issues that need to be noted are that in 2023 we had the third national summit, and there had not been a summit since 2011. And at that summit, we were aware that we could not have a service provider. So the CDA members, particularly the independent members, ended up leading in terms of managing the event itself from the time of the provincial dialogues right up until the summit itself. And this then shot up the cost as well as the actual implementation, or rather the actual event itself, paying for certain parts of the National Summit. Though we must say that for this summit, we were fortunate enough to be able to get funding from external funders, and we are quite appreciative of that. And that included SANAC. And then the recommendations that we're making on this is that we need to capacitate our Secretariat office to ensure that there's prudent management of the CDA budget, because the CDA itself is not has no control over the budget. So we never know what is actually happening there. We may be requesting certain things, but we do not know what the processes are in terms of approving or declining or paying for things, and what happens behind the scenes. And this is a challenge, but we are saying let our Secretariat be capacitated to be able to manage this budget. And then we are also proposing that we be involved in the budget planning with the department to ensure prioritization of overall oversight over the implementation of the National Drug Master Plan. Our responsibility is the National Drug Master Plan in its entirety. The chairperson mentioned and indicated the roles and responsibilities, which is 13 of them, besides the one that it says that whatever the minister might say we need to do. So we need to then sit down with the department and decide on which of those priorities that we have identified in the APP, because we have developed an APP and we have identified certain priorities. So we need to sit down and say, of these priorities, what can be done and what cannot be done. And then in terms of challenges, the chairperson and myself throughout this presentation have mentioned a lot of these, and I am not going to go through them, so for the sake of time. And then in conclusion, we are saying that the annual report, it reflects a year of significant achievements in combating substance abuse through the implementation of the National Drug Master Plan. However, it also underscores the ongoing challenges that need to be addressed to enhance the effectiveness and impact of these national efforts. We as a nation remain committed to achieve a South Africa free from the harmful use of substances and illicit trafficking of drugs through improved coordination and collaboration in accelerating the implementation of the NDMP. Chairperson of the CDA, may I hand over back to you? Thank you.
Thank you very much, DM. Thank you to the chairperson of the Select Committee and the members, honorable members of the committee, honorable Deputy Minister. So because the second part of the presentation was for the CDA to present the review, the National Drug Master Plan review. So we want to report that there is a task team that has been set to review the National Drug Master Plan and to develop the 2025-30 National Drug Master Plan, as the DM indicated earlier on. And the task team is chaired by the Social Development Director for Anti-Substance Abuse. And therefore, I'm not sure if the director is here, Chair. We of the Select Committee, we request that the director can then take the committee through in terms of the draft, because we have been informed that there is a draft National Drug Master Plan. Thank you, Chair.
Thank you, Chairperson. The director can proceed in terms of the draft plan.
Okay. Good morning, Chairperson. And my name is Isabella Sakawana. I'm currently acting DDG starting from Monday for welfare services, and I can't see the director here. I just want to check from the team if they know what should happen with regard to the presentation, but I don't see anyone here. Wisani, are you here? Wisani? I really want to apologize. Maybe there's something wrong with their connection or so. I'll have to try and check, that where the director is, and then come back. For now, let's maybe try to to defer it until such time we get clarity in this regard. So I want to apologize for that. Thank you very much.
Thanks, DDG. We will now proceed to the deliberations. You can sort that one out. So, honorable members, we have received the annual report of the Central Drug Authority. We will now proceed in terms of questions. I see Honorable Adrianse first and then Honorable Aris. Honorable Adrianse, you can proceed.
Thank you, Honourable Chairperson. I'm quickly switching on my video just for a second so that you can see me, and then I'll switch it off for bandwidth purposes, that everyone's data is not going to disappear on them. First of all, I would like to thank the presentations. This was quite insightful, although the 20 million really shocked me. I feel that 20 million for prevention will be much better spent. We must look, as our Deputy Minister stated, it will be much better to, prevention is better than cure. Because in many instances, especially with cure is next to impossible. So I absolutely agree with the Deputy Minister that that's the route to take, and to work very hard on prevention. The flip side is, however, that although the success is minimal in rehabilitation, we can't throw it out totally, and we still have to have our rehab centers fully functional with proper treatment. And in many cases, the 6-week programs that are utilized at the moment is simply inadequate. And the aftercare of that is very, very important, must be looked into. And I appreciate the focus on the LDAC committees. It is unfortunate that the province where I am from, Northwest, haven't submitted their reports. And I would like to receive a report on what the reasons for that were. Because in the province, there are private entities who also want to establish drug rehab programs without needing funding from the province itself. And they're struggling to get accredited and accreditation from the province. Now, going to the report we received, I need some clarity on the first page of that report. On the first, I just need to open it here. I think it's the first, let me just open it again. Yeah, the first goal, drug demand reduction. And that's where the Department of Social Development and everyone comes in. And then we go to the Department of Higher Education and Training on that page. And it says here, higher health was funded. I presume higher health is now the hospitals and everyone, and post-school and education programs were rolled out with 20 billion. Or 20 million in this case. But in any case, so the program reached 575 students. Now, at first I thought this must be a typo. And this is what I want to clarify. Because if that amount of money was spent for the education programs and only 575 students were reached that could be vouched for. This means that the cost per student amounts to 35,833 rand and 5 cents per student. And the feedback on this from these students, what was it? And in this time, and we know how much the problem is and how big the problem is amongst our students. It's massive, especially in the Northwest. Only 1,070 took part in self-screening. 42, only 42 were referred for drug and alcohol abuse. Now, if you've seen the amount of accidents only in Potchefstroom while students were under the influence, although they were officially tested for driving under the influence, but you could smell it from afar. And only two were diagnosed with addiction, and 2 received drug and alcohol abuse counseling. I want to come back to what the Deputy Minister said. Where's the prevention in this? And this whopping amount of money and many millions spent. What happened here? Where was it spent? And how was it determined that only 575 students were reached? Is it deducted from the pamphlets, the dialogues, and all that? Because then this process needs to be revisited, and it's scary that we're working with so much money. What is included in this program that's been rolled out? Because it seems like wasteful expenditure. Then there's another point, and it was on the cannabis bill. I was partly covered in the presentation. You said increase of usage has been detected since it has passed. And I want to know if, since the increase has been detected, have crimes on the rise also been detected directly related to the cannabis bill being passed? So, and if it indeed was investigated, because we know with other drugs, there's a direct linkage, but specifically in this case, has research been done on that? So I'll stop here to leave some questions because there's a lot of questions arising from this, but the rest I'll put in writing. Thank you ever so much.
Thank you very much, Honorable Adriaanse. Honorable Feni. No, it's Honorable Aris and then Honorable Feni.
Yeah, thank you very much. Good morning, Chairperson, and thanks for the presentation to the presenters. I just want to check with them what measures they have in place to curb the influence social media have on our teenagers in terms of drug use. And then the CDA program, we don't see it play out on the streets or in the communities. What awareness programs they have in place? And how often are they doing these programs? Because I don't see any of that. And then, Chair, I'm worried about the effectiveness of the CAD, as this previous board was not really functional and lots of vacancies on the board. Are there a need for this board? Because we don't see the impact on the ground. And what measures are there in place to monitor the effectiveness of the CDA? And we have a shortage of public drug rehabilitation centers. Our families or our children that are coming from poorer families that don't have money, because most of the drug rehabilitation centers are privately owned. And it means that you have to pay a lot of money in order for your child to go there. However, there's very limited public drug rehabilitation centers. And I want to find out what is the plans to ensure that in each and every municipal boundary that there are a drug rehabilitation center, because the reality of drugs these days is that our young people are hooked in this, and our young people in these drugs, and our young people get lost for society because of their family's financial circumstances, and they cannot afford these private rehabilitation centers. And then I want to check with the CDA, are there any working relations or MOU with the police and the CDA? Because our communities are unsafe our elderly are unsafe, our people get robbed, and the crime rates increase because of these drug addictions. And then also I want to check in terms of, do they have statistics on people that have lost their life or fatalities due to drug abuse? Because I didn't hear anything about statistics in terms of fatalities. And then the last question is, Chairperson, I want to check how regular does the CDA get updates on these people that passed away due to drug use? Thank you.
Thank you, Honorable Aris. Honorable Fanny, over to you.
Thank you, Honorable Chair, and then also let me greet honorable members and then also the presenters. Let me first also to welcome the presentations which are elaborate, and then my chair is around the question of the cannabis. I think because we are consistently conflating the cannabis use with drug use, chair, of which, even though that there are certain strides that have been made and recognition that was made through the legislative processes to enable those who are in positions of ensuring that economically cannabis becomes one of the critical component in ensuring that there are economic activities and also contributions which is coming from the production and product itself. However, Chair, I believe that there must be engagements or a cooperation between the Department of Justice with the Department of Health, where there will be consistent education to our people, especially those that were not allowed to utilize the means that they are having, because police today are still continuing to harass, people who are trying to make ends meet through this production. And it is therefore a proper education. If it's not done, we can even go now to jail. There are people who are on trials because consistently they are being harassed and arrested by the police. So I believe that if that justice is not being done at this level, Chairperson, we'll be moving around the cycle, failing to differentiate between these dangerous drugs that are killing our people and also the legal use, because I must put emphasis on the question of legal use and production indeed of cannabis. So a cooperation must be done. That is why you will find that you have a number of cases that are not being resolved, and we have a problem of capacity in our correction centers on the base, and especially some of these cases, they are just thrown out of court because they are discovered that they are not serious cases that need to be treated as such. So I'm trying to say, Chairperson, education is very critical. On this aspect, I just wanted to comment on that one.
Thank you, Honorable Fanny. Honorable Duplessis, and then after her, it's Honorable Ngobu and Honorable Chirwa, and then Honorable Sibande. Honorable du Plessis, over to you.
Thank you very much, Chair. I think by now it's been covered. There's just a few points that I need some clarity on. The council was established in 2021, and we just need to make sure that we don't just establish committees or councils or boards that are not affecting change on the ground. An example would be within the community that I work in Johannesburg. It's Region G. There's incredible amounts of drugs, and one of the neighbouring one of the neighbouring wards was mentioned as Eldorado Park. However, there is no support given to the people in the community, and these plans do not seem to be implemented within communities. Please guide us to what the plans are and the timelines are to ensure that we look after the communities that are most at risk. I am a little bit. I do need to support it, not for any other reason, but I really truly believe that synthetic drugs are a much bigger crisis than the cannabis crisis. And I'm concerned that we are getting tripped up in the conversation about cannabis because it's a, for lack of a better phrase, a sexual topic. It's a topic that everybody's engaging on worldwide, but it often sort of digresses the attention or removes the attention from where it should be, which is on synthetic drugs, on heroin, on cocaine, and these synthetic drugs are literally eating people's brains, and we really need to do something about that and really have that focus. So thank you very much. It says, and most importantly, synthetic drugs, but I'd like to point that we need to ensure that we discuss synthetic drugs more than drugs that have lesser impact. The next question I have with regards to the needle program, there is no mention of it on here. I do know that some metros are implementing needle programs, but unfortunately, in some areas such as Linden in Johannesburg, there is a mismanagement of this where allegedly officials just dropped a large amount of needles in a park and drove away. So it comes down to ensuring the responsible implementation of these programs, which they are incredibly delicate, as you are aware. And then just the last point, I don't know how true it is, but I believe there's a shift towards what they call Bluetoothing, which is drawing somebody's blood that is already high on drugs and then input or then inserting it into their own bloodline so that the drugs from somebody else's blood impacts somebody's state of mind. And then just with regards to psychosocial support, there isn't much emphasis on there. And then the last is with regards to the economic cluster and the request. Could you clarify what exactly we need to ensure that the economic cluster is reporting on? I know you touched on it on the report, but just a little bit more detail. Thank you very much.
Thank you, Honorable du Plessis. Honorable Chirwa. Nobo first and then Chirwa. Honorable Nobo, over to you.
Thank you, Honorable Chair. Honorable Deputy Minister, I appreciate the Central Drug Authority's efforts in addressing the complex issue of substance abuse in South Africa. However, I remain concerned about the effectiveness of the National Drug Master Plan in achieving its intended goals, particularly in light of the ongoing challenges faced by our communities. Can the Deputy Minister provide a detailed breakdown of the progress made in implementing the National Drug Master Plan, specifically in regards to the 7 goals outlined in the plan? Furthermore, what measures will be taken to address the funding constraints and capacity challenges that may hinder the successful implementation of the plan? And how will the CDA ensure that its efforts are aligned with the broader national development priorities? Thank you.
Thank you so much, Chairperson. Greetings to all the colleagues and the Deputy Minister and the CDA. My name is Naledi Chirwa, and I'm from the EFF. And Chairperson, through you, I think the concern, or rather the questions that we want to ask, are geared towards firstly establishing the impact of the CDA in the work that it is engaged in. I think the CDA highlights us to very crucial aspects that hinder its work, or rather become a barrier in doing impactful work. And I think we shouldn't let those alerts go unheard or unengaged. For instance, the CDA unwittingly then states that there has to be much more work that is done with stakeholder relations, which then raises the question: what is the current status quo? How is it done currently to create stakeholder relations, and which stakeholder relations are currently built on, despite NGOs, like in the community sense? Who are other stakeholders that you are engaging with? Does it include religious leaders? Does it include traditional leaders? And to what extent? So give us a detailed or really like tangible view on what these stakeholder relations look like and what their contribution, especially on the prevention aspect, but not only on that one, but also on the rehabilitative aspect as well. What is their role? What is the stakeholder relation role that you have fostered since 2021 in communities, in interdepartmental government stakeholder relations, in different aspects, but in a way that explains the role of each stakeholder? Because then otherwise, then we are made to think or believe that these are just conversations that take place between stakeholders and not actual work on the ground, or rather impactful work. And then second to that, I just want to caution the Deputy Minister on the sentiments shared against, or rather sentiments that say that the rehabilitation aspect, because the government is not winning on that path, that it then becomes less important of some sort, and that the preventative measure then takes the most important positioning. I think that sort of thinking is quite dangerous, especially noting the fact that when you deal with drug use, even the ones that are already in substance harm, and you're dealing in substance harm reduction programs, you are preventing other things from happening. You are preventing deaths. You are preventing pregnancies that end with the babies or infants being compromised to health. You are preventing crime. So even actively engaging in harm reduction or substance abuse reduction is actually a prevention mechanism on its own. So that view to say that then we must abandon, or rather almost sort of neglect or not focus too much on the substance users that are already on the substances, I think it's rather short-sighted and doesn't view in the broader picture, especially because many of people who are on substance abuse are actually victims themselves. They are victims of the environments they are in. They are victims of abuse. They are victims of the violence that they encountered. They are victims of being forced into substance abuse. They are victims of economic disparities and economic inequalities. And we cannot just sideline them to the side because then the government is losing the fight. There has to be a multifaceted approach to dealing with substance abuse and harm reduction in relation to substance abuse. And I don't think the CDA was able to show us how they are able to do that. For instance, we are not getting the aspect of mental health. In what ways is mental health being an aspect that is targeted by the CDA, by the department in relation to substance abuse users? We need to get the picture. What is the social support that is given to them? What is the economic, in the long term, what are the economic interventions that are given to them? Because the money and the figures we are getting here actually say there's a lot of work that is being done, but we all know in this community, the Deputy Minister knows, the CDA knows, that this is not the reality. That is why I want the CDA and the department to break down in tangible terms. One of the members cited a very important aspect, that what is this 35,000 doing for each student? Give us the numbers. Does it include accommodation? Does it include food? Why is it 35,000 rands per student? you need to give us a much more detailed brief on what this money does. Is this money paying salaries? Is this money doing the actual work? Is this money getting people who are in the streets off the streets? And what do those numbers look like? Because to throw around millions and millions, but then cite very little work or impact of that work on the ground, which we actually see with our own eyes, is actually very traumatic. It makes us to believe that the very same scourge that we know is haunting this country of corruption is even more imminent in this case of substance abuse. Shuti, the rot is so deep that even the money that is meant to save people from drugs is being put into the pockets of gorgons. And that can't be a culture that we condone as a committee. And lastly, we want to find out particularly on these programs, particularly on what the monies are doing in the prevention aspect. How do you do the prevention? And we really would like to see the picture and not just we need to see the picture. How are you reaching these people? How much money is being spent to reach these people? Which platforms are being utilized to reach them? And also the parents that are involved, because when you deal with, especially with the young people, you cannot isolate it just to being an issue of young people. How are the parents involved in these programs that you are initiating? But on the prevention side, we're very keen to find out what this money, on which you are now saying you're moving more of it to the prevention, how you are moving it, and how exactly is it going to do the work that you are saying it's going to do. Thank you so much for the opportunity, Chairperson.
Thanks a lot, Honorable Chirwa, Honorable Sibande, and then Honorable Mokwele.
Chairperson, let me identify myself, and then after that, I'll close it. Chairperson, I also wanted to echo my sentiments by joining my colleagues to welcome the report, but at the same time, I wanted to reserve myself in some extent because I believe that center, there is a proverb which says a center must hold, which means that somewhere there is a link between the department and the sector itself. That means there's something wrong there. And then also, I don't want you to find out, because of the things which I'm going to raise, maybe the indicators at the end they will indicate as if the sector itself neglected its responsibilities. I'll explain how. Because also the factor is that if we can use a barometer to measure the performance of the sector itself, let me go what I'm meaning by saying that. You see, let me start with the DM. I'm very happy that the DM is so open to indicate what are the challenges. But he said we must do away with silos to start with the district model. I agree. The question is that what measures have been done to make sure that some of the concerns he raised are corrected? And then the issue of the 10% of I think the councillors, if I'm not mistaken, which are complaining, are complying versus the sabotaging of the drug plan. That is very sensitive. What has been done then to correct that as well? Also, he raised an issue of the NGOs and NPOs that crossed the Rubicon. I think that must be corrected. That you say the thing is one from my side. Let them indicate that this one and this one and this one are crossing the Rubicon. I'd like to put in an overall blanket so that we can deal about that problem as it comes. And then he also indicated that we need one plan, one budget. I support that. And my concern also raised that the CDA was stopped to use money in the month of March. I wanted to find out that how much, I mean, how was the impact with that process of stopping the CDA to use money? What was the impact? How much was, I mean, I can regard it that it falls against the east of perimeters of fruitless and wasted expenditure. How much was lost in that period? And then come to the presentation. Let me start at the back. There is something which is worrying me that in terms of human resources, the CDA director was never being appointed. Also, that's why I've commented on in that way before I've started to ask questions. What was done in that regard? Because what measures have been implemented to try to get the director to be appointed? Because you can complain it to us as an NCOP Slack committee, but while you didn't try to make any attempts in that regard, was any attempts made to make sure that the director is appointed? And then also, they've raised that Act, I can't remember whether it's Act 7 of 2008 or Act whatever. You see, I mean, my worry is that the green light was given to you long ago, 2009, 2008. But so far, why we are so quiet all along? And then also, they've raised that there was no summit since 2011. Count how many years from 2011 now. Why? Why they were waiting for what? What attempts have they done in order to correct that one? And then they also propose to be involved with the department. Was there any attempts, about trying to involve the department? What was the response from the department? Because you know why I'm asking that question, in particular with the department, so that we can confront the department about that in that regard, that why, if they tried to involve them, why they didn't respond positively in that regard. And then also, I wanted to find this one. In terms of regulatory regulation reforms, let me say it's government performance. They've raised the issue of members never bother themselves, never support. I wanted to find out also what measures have been taken to make sure that they are complying, because that is an issue of complying. If the people doesn't comply, they must also indicate that this was done and then these people didn't comply. And then there is also one which is very sensitive. I laugh when this one they've raised it. The issue of working closer with the Republic of South Africa, working with USA in combating drugs. You know why I'm laughing? Because internationally we've become a laughing stock where they are crying babies. When we try to address the problem, the crying babies will run to America and tell them, in South Africa, do like this. While here, we commit ourselves to work closer with them. But at the same time, some of the authorities, they reject our attempts. Therefore, my question is that since the status quo is like this, whereby the leadership of the Americans indicated that they are cutting ties with us, does it have any impact with this? Or how is it? Does it have any impact in regard with our relationship concerning this in terms of combating drugs? Because it means that they've terminated some of the services to us, which include drugs and some of the things. I wanted to find out from there. And then also challenge in government only, yes. You see, there is something which is worrying me, that the sector doesn't get reports from the economic sector or economic cluster departments. What have you done in order to correct that? I've got a lot of questions. Let me leave it like that at the moment. But I'll be very much, Chairperson, please, I want you to request that the sector to make sure that they respond to some of the questions, failing which that they make sure that they do in writing, because there is a tendency in most of the interaction between us and the sectors and some of the departments, whereby they don't respond, they keep quiet. They expect us to rewrite the things which we have asked, as I'm asking now. That thing must never happen. They must make sure, and they open a space whereby some of the people, they take off on what we have asked already, as if it is written by somebody else, while it's us have made those recommendation and etc. And then lastly, I will emphasize that have they make, what is it? The issue of the 7 goals and also the drug use. They've complained about the persistence of smoking, in particular the issue of hacker pipe and vaping. Yeah, I agree with them. It is dangerous. It is proven outside this that our kids, in terms of when they're applying for jobs, they do pass with their qualifications, with the interview, but with the test of healthy test, it is a problem. Yes, it's true. And also, I do support that with their proposal that things must be regulated. I do. But they must reinforce about the issue of teaching people and interaction with other people. I wanted to get clearly their program so that you can support it. Thank you, Chairperson. Thank you also from the CDA.
Thank you, Honorable Sibande. Honorable Mokwele.
No, thanks very much, Chairperson. Greetings to honorable members. Also, greetings to the officials from the department. Chair, let me join others by welcoming the presentation from the department. Maybe differing from not all other, but differing with other members a bit, just to say that from the presentation that has been brought before us, I've seen a lot of stride, to be honest. I've seen a lot of stride because, in particular, with the approach whereby the department is making an appeal to all of us to fight this thing of silos, to fight this thing of us working parallel to each other in dealing with the issue of substance abuse, which I really commend, because initially, especially us as government, together with other stakeholders, we normally thought that it is only the responsibility of the government to deal with the thing of fight against the drug abuse. But also to raise a disclaimer, especially about the thing of cannibalist use, the thing of, in my language, we use it, departure, which they normally now says that it can be used to heal certain diseases, even though, yes, they did discover it. But the issue of strengthening the issue of age, it is a thorny issue, honorable members. I also served as the member of the school governing body where I'm coming from in my constituency in Mokopane town, whereby we have confronted with this problem, whereby majority of learners immediately after the department or after as government, we have said that the use of cannibalism now open. Majority of learners, they were even abusing it in such a way that they can bake some cookies. Learners, which other learners, some of them, they even went to the hospital and stuff like that. But we have to confront that. So I should think that as government, even though I'm not against the fact that now it is now open to everyone, but the issue of awareness in terms of where it must be used, because to be honest, the reason why we can't build the economy, I'm happy that yesterday we were with the Minister of Health, where he was articulating the effect of having the society that is not healthy, how it contributes to the growth of the economy. So I should think maybe all of us, we need to come up with the strategy to say, how then do we cap this? But also, as other members, they've been indicated, to say that there is an issue that the department, they never came up very clear to us, especially with the issue of this thing of regulating the issue of alcohol. We all know that in some other area, like in the province where I'm coming from, there is a regulation that has been enacted whereby they've stopped these liquor outlets to operate in a specific time, so that we kept this thing of abuse. We all know that the issue of liquor and cigarette, at some point in terms of economy, it grows economy. You can't stop them totally, especially looking at the issue of economy and other things, and also to entertain. But where it comes to the issue of abuse, we'll always try to make sure that they need to come up with a clear plan to tell us, to say, because remember, when they come to prevent before us, they come so that they also appeal to us as what is it that we can do, so that even ourselves as members of the select committee, when we go and do oversight, or when we are at our constituency, we come up with a program that is guided by the plan that they will be presenting before us. But safe to say, honorable members, a majority of honorable members, they've covered me on some of the issues that we are expecting from the department. But as I will be concluding, Chair, is the issue of us working together, not only at this level, at all chairs of government, so that we are able to make sure that the mission that the department has started throughout, it is realized, and we make sure that our society always live healthy, so that they can also participate actively in the economy. So with those few words, Chairperson, I'm going to pause here and say thanks very much for affording me the opportunity. And even lastly, Chair, with the issue that the honorable members have requested that they must give us the detail, I should think, because this thing of written response, Honorable Sibanda, has been said many times in the meeting. But at some point, I should think the Chair, we need to have a time whereby, as the select committee, we are dealing with written response, because since we have been requesting departments to give us written response, but we never had an opportunity at some point to deal with them, just so that to make sure that indeed they have responded to us accordingly, other than just saying it for the sake of being just compliance. So that is the last point that I'm requesting to say, that, Chair, we need to make sure that we come and deal with those responses. And thanks very much, Chairperson.
For that, honorable members, my network is very bad, but I will try again. And I just want to check in terms of the awareness programs, in terms of this e-cigarettes as well as this occa pipes of what you call it, because our youth is really into this and it's really affecting them. And the other one, I just want to check from the Central Drug Authority, is this reports that the department is not submitting. What reasons do they give that for not submitting these reports, as well as their their master sector plans? So then I want to request from the Central Drug Authority, they must just highlight in terms of answering, and they must give us written responses in terms of the questions that was asked by the honorable members. So, Deputy Minister, over to you.
Thank you very much.
Chairperson.
Honorable Baines. Yes,
Chairperson,
Honorable.
I struggle with my gadget. I could not get my hand up. Can I have a little bite quickly before you hand over?
Thank you, Honorable Baines. You may proceed.
Right. Good afternoon. Thank you, Chairperson. Good afternoon, honorable members. Good afternoon, all the officials. Chairperson, my little sense, I would like to apologize. I'm also in a space where I struggle with the network. But I could at least hear part of the questions. I have the opportunity to look at the presentation, and I would not like to waste any time because I am also partly covered. Oh, yo. Hello. Chairperson, can you hear me?
Yes, Honorable Baines, you may proceed.
Okay, I'm covered by the honorable members, especially Honorable Mokwele, where he said that according to the presentation, you can see that a lot of strides have been made. And I would love to applaud the department because, Chairperson, all the time our problem is the working in silos. And I think with this presentation, being very, very honest, they want to cry out, telling us that we need now to work together because I think that is our ultimate goal. And I would love to say, Chairperson, being in the local drug coordination, I know what everything means. Honorable Sibanda talked about sabotaging. And that is what we had, especially in the Western Cape, where some of the communities feel that drug abuse is not part of their community. So they do not cooperate. I was there in person. We actually need to have a lot of empathy with those people, starting with those different committees. And I'm so glad to be part of this committee now so that we can work together. So, Chairperson, this is actually my plea that we need to stop playing the blame game. The department did not do this and the department did not do that. Ask me, I was part of everything, especially in the Western Cape. I thank you, Chairperson.
Thank you, Honorable Baines. Deputy Minister, over to you and the team.
Thank you very much, Honorable Chairperson. I would like to thank the honorable members for raising very critical issues and I support you, Honorable Chair, that we need to respond to each one of those questions in detail, in writing, because that is going to help us on the way forward. But Honorable Chair, I want to just assist, or not assist, but inform honorable members that we are talking today about the Central Drug Authority and their role when it comes to drugs. They have only one role to play, and that is to oversee. They must oversee the 200 to 300 mayors doing their jobs. They must oversee the Department of Social Development do their job. They must oversee the 9 provincial structures, and they must also oversee what NPOs and NGOs are doing. And they must report. And that they've done very well over the years, and also today. Their job is not to do any work whatsoever, but to oversee and to report. And when they report, it is up to Parliament, it's up to the NCOP to take matters forward. So, so some honourable members seem to be disappointed that the CDA doesn't have programs. No, it doesn't have programs. Its role is to oversee. They want to do more. I know that. And there's a bit of overreach, and we need to then have the one plan, one budget, which I referred to earlier on. So if you want to find out why we have made no progress whatsoever for the last 10, 15 years, you ask the 300 mayors, you ask the 9 provincial structures, you ask the Department of Social Development, which is one of 20 departments that are responsible. You ask them. You don't ask the CDA. You ask the CDA, yes, what are those people doing? And I heard one honourable member ask, why did the Northwest submit a report? So that is where we stand now. I'm going to try to address some of the very key issues that honourable members have raised. The one issue about cannabis and the fact that the police are doing their work. I can't see why honourable member is telling the police stop doing your work. Police must do their work. And just recently, the Minister of Health issued regulations with regard to the use of medicinal cannabis. And I know that the Minister of Health and the Department of Health, while they respect Parliament and the NCOP for allowing the use of cannabis with respect, the NCOP and Parliament didn't do an impact study on the effects of what they legislated. And the Minister of Health, in now seeing the effects, has struck the first blow by issuing regulations, and already the industry is now very upset about this. And even honourable members on this select committee are upset about putting checks and balances when it comes to the legislation that has opened the doors for cannabis. You cannot create jobs, and if you create 10 jobs, it kills 100 people. That doesn't make sense, and that is the effect of the legislation. And the Minister of Health has talked about using the new laws to lace ice cream. These substances that come from every part of the cannabis plant are being used, and children are being groomed groomed to be the next generation of drug users and drug peddlers and drug lords. So with respect, honorable member, I know you want jobs, you want economic activities, but we can't create 10 jobs and kill 100 people. It doesn't work like that. So I refer to the fact that and our honorable members raised the issue of whether the drug master plan, what is the impact? Has it reduced the harmful effects that this is all about? It hasn't, but that is not based on evidence. We need research to show that the drug master plan, and we've had 2 plans or 3 plans. This is now the 4th plan. We can't have plans after plans, and then the situation gets worse and worse and worse. So for whenever we adopt a drug master plan, if you look at the evidence, things get worse. So the drug master plans are not working, and I hope the next one, with the help of this select committee, will work. So there are many other issues that have been raised. I've cleared up the role of the NDA, of the CDA, the Central Drug Authority. So don't shoot the messenger. They come in to report to you. Don't ask them what programs they've done and about the students at universities. That you must ask other people that are responsible for it. Certainly they can report on it. I've referred to the fact that the legislation may have to be relooked at, but that's another process. The Minister of Health must take the lead, and he is taking the lead. And if he has his way, he will throw that legislation into the waste paper basket. Unfortunately, after all the hard work that has been done and the hopes that it's created to create jobs, improve the economy. But not even a year after the legislation, the Department of Health have already seen the disastrous effects of cannabis. And but maybe there is still a role. We heard that cannabis is a cultural plant or a herb. It has helped a lot of illness and diseases. But then the act must then confine itself to that and not open the doors to create 10 jobs and kill 100 people. So I would like to thank you for this opportunity. I would like to ask the Central Drug Authority. They may want to answer some questions, and I'm sure that the ones that they can't reach or need more information on, that there will be written questions. Thank you very much, Honorable Chair. And once again, thank you for the honorable members for putting forward very relevant and important questions, and they're leaving a legacy behind in that they are contributing to a new or a revised 5-year drug master plan, and we will have a future generation free of drugs. Thank you very much.
Thank you, Chair. Should I add on to the DM's responses, Chair of the Select Committee?
Yes, please, Chair.
Yes, no, thank you very much, and thank you to the Deputy Minister for responding to the questions raised, and we commit, Chair, if you can just give us a time frame, maybe at the end of this session, as to when you would like us to present the answers in writing, because we are prepared to do exactly that. Just to add on the Deputy Minister, in terms the importance of prevention, Honorable Rehanse, is very important. At the same time, I think, as the other honorable member was saying, we also need to balance that with treatment as well. So, but prevention is better than cure, and we want to agree with you on that. And it's also not only about that; it's also about aftercare. as you have indicated, Honorable Rehanse, it's about aftercare, so that once people have been to treatment, they should go to aftercare programs. That's where they, they get strengthened. That's where they also get into various programs of skills development, training, of entrepreneurship, etc. And so those are the main programs that the departments, as the DA is saying, it's not the CDA that implements the prevention, treatment, and other programs, but it is the departments that are led by Social Development Department. We will follow up on the Northwest. In fact, Northwest submitted very, very late. And we also got very concerned when we received the report very, very late. And we will still further engage. What is encouraging, Honorable Member, is that the MEC, the new MEC, has now taken up this matter. And the new MEC has now also reappointed the members of the Provincial Substance Abuse Forum. And those members will then be hard at work going forward to ensure that they address all the problematic areas in the Northwest, and that they report timeously to CDA as well. The issue of the higher health, we will raise it with the health department, because higher health is a non-government organization that is contracted by the Department of Higher Education and Training to do all this work. So we'll raise it to the department to say the committee needs information as to how can they be allocated 20 million rands and only do the work, the minimal work that has been done. So it's only the Department of Health that can be able to, to answer that. And once we have that answer from the Department of Health, we should be able then to report to the committee. But indeed, we have a role to play as the Central Drug Authority, because we need to monitor, the resources that are being used to address the scourge of HIV. In terms of cannabis, Honorable Rehanse and Honorable Feni, indeed, the CDA does recognize, the economic potential. I think our presentation does make reference to the economic potential of cannabis, medicinal potential. In fact, SAPRA has approved the cannabis for medical use under strict conditions, though. But we also realize the health risks as well, because it is true that it does, cause some respiratory problems. It does cause some mental health disorders. Some of our family members have been affected by this. It does affect cognitive impairment. So what is important really is public education and strong regulation to really mitigate these risks. But yes, we are aware of the Cannabis for Private Purpose Bill that was passed by the National Assembly in 2024, which really regulates personal use of cannabis, possession of cannabis, cultivation by adults. This is very, very important, that should be cultivated by adults. Children that are found using or in possession of cannabis are dealt with outside of the Criminal Justice Act through the Children's Act or the Child Justice Act. So yes, Honorable Member Feni, we do recognize the economic importance, but we also need to see a balance between the economic importance as well as the social and health risks that are there that need to be mitigated. And of course, I think we agree with you that there must be research to be done to measure the impact of what has been done by the country already. We indicated that as the CDA, we do not have the funding for research, but we are talking to the Deputy Minister. We've spoken to Social Development, and they are looking into this. There is a plan that Social Development is looking at to do research and collect data on these issues. And then on Honorable Aris, in terms of social media, indeed, we always advise those who are implementing the National Drug Master Plan to really use the social media space, because children and young people, they can be educated and awareness can be created through social media, because they tend to rely on social media most of the time. And so we've advised departments to do exactly that. But as CDA, we do have a website, and we have a social media page where we post some of the information that is there to really empower young people, the users, and children as well. And then in terms of the CDA, program on the street, like the DM has said, we don't really work on the streets as the CDA, but the departments are responsible to work on the streets, social development, to work on the streets with the local drug action committees. And I think we've reported extensively where the situation is with the local drug action committees. Local drug action committees must actually involve all stakeholders, most of the stakeholders in the community, in the community at the street level. We're talking here about the faith-based organizations, Amasonto. We're talking about the local businesses that must be involved, but most importantly, the departments, the representatives of all the departments at the municipal level, your social development, your health department, your local economic development, etc., that must really be part of the local drug action committees. In terms of vacancies in the board, we were 11 elected by the minister, appointed by the minister. 2 have resigned, and we did inform the former minister, but we'll have to inform the current deputy minister who's responsible for this portfolio. And then it's up to the principals whether to replace those that have resigned or not. In terms of the departments, we also escalated the matter of the 4 departments that have never participated, no submitted reports to the former minister, but now we'll definitely need to escalate this challenge to the deputy minister, because we as CDA can't talk directly to ministers of these departments, but it's our minister and deputy minister who have that authority to speak to the other ministers to ensure that these departments are accountable to the CDA. The issue of monitoring and measuring impact is a big one. We have started to discuss it with social development and other departments to say that there is a need. There's a lot that is happening because the work that we receive, the work that has been done by the department, we are told that it's verified. It's work that has been done. It's work that has been verified. Without verification, they don't even report to the CDA. They will tell us, no, the report has not been signed by the minister or the DG because the information still needs to be verified. But the issue here is, what is the impact of this work? Because we see in the report there's a lot of work that we've presented that is done by the 20, or let me say 16 or 18 departments that have reported. But what is the impact is something that still needs to be done. Social development CDA are discussing to ensure that there is an impact assessment of the work that all the departments are doing to address this particular matter. And I think Mem Sekawana will also address the issue of treatment centers. I think Honorable Aris was saying there's a shortage of drugs treatment centers. We know that there are 12 public treatment centers. In each province has a public treatment center managed by government. But then the issue here is that there are many other privately owned centers which are charging enormous fees to the parents, to the users, and that remains a challenge. And that's where probably DSD will assist to respond to that. But we've raised this issue of the exorbitant fees that are charged by the private sector, so that there's no access. Those who are suffering from unemployment have no access to these privately used spaces, but they can go to the public managed centers. And then the stats on people that have lost their lives through facilities, we are briefed at least once a year by the Department of Transport, on the statistics of the people that have lost their lives, but would like to receive these reports on at least biannual or quarterly basis, so that we can see the effect of drug use, alcohol use to people who are on the roads. But it is indeed a challenge that we need to address as a country, beginning with families and individuals and communities, so that we don't drink and drive and then our people die on the road. So we do receive reports, but we need to receive them on a regular basis. And Honorable Fanny, I think We've responded on the issue of cannabis. But yes, you raise a very important matter in terms of education, also with the police. The police have also raised this matter with us, where the people who are being assisted, the users who are being assisted with the opioid therapy, when they are carrying the needles, they're actually harassed by the police. It's something that we are now working with the South African Police Service, and there's a lot of cooperation in that space. So yes, we agree that there should be education, also with our officials who are doing this work on the ground. And Honorable Du Plessis, the issue of, you're correct to say that structures should be established and the structures should make a difference on the ground, and the DM has explained exactly what the role of CDA is versus the role of government departments that must really be doing the work, and we must be able to oversee and report to yourselves. The issue of El Dorado Park, I think it has been raised, and really we as CDA even visited El Dorado Park really to see what is happening there, and then subsequently there were engagements with the police, but it's never enough. These should be ongoing engagements with the police for them to assist the community to address the challenge of drug use, the challenge of shootings in the community, young people and children dying, in the crossfire. Yes, the issue of synthetic drugs is very, very important. We continue to discuss it as CDA and as a country. I don't think we are only relying on the United States, given the current status quo. I think as a country, we really need to be self-dependent on these issues. And the minister, in fact, was leading the debate, I think the former minister, and now we know that our deputy minister will take this matter up in terms of discussing it further and finding solutions, because it is definitely a dangerous drug, because it's synthetic, it's manufactured from other drugs as well. The issue of the Bluetooth drawing blood from the users is also a very, very dangerous situation that we are addressing together with the South African Police as well, together with the Department of Health and Department of Social Development. And the issue of psychosocial support, it's part of the whole program on demand, drug demand reduction that we are basically working on. The issue of economic cluster, we had escalated it to the former minister, and now we should be able to escalate it to our deputy minister, who's now in charge of this portfolio. And those are the powers that the CDA have. It's just to encourage all the stakeholders to cooperate in a multi-sectoral manner. But if they don't, we have noticed there's nothing else we can do. We just talk. And if we fail, then we can only escalate the matter to the political principles through our own political principle. And then maybe let me leave the other issues to the deputy chair to continue. But yes, the emphasis is really on prevention, but also with those users who are using and misusing alcohol and drugs. They also need to actually get treatment, because this is a disease, honorable members. Drug abuse is a disease of the brain, and hence the other member was talking about mental illness. And it is the Department of Health that is then addressing that issue around mental illness. But social development does address the psychosocial support of the people who actually use drugs. Deputy Chair, maybe can take over from here.
Thank you, Chair. I think you've answered Honorable Ngobo. Honorable Chira, on the stakeholders, that the stakeholder relations, trying to make them stronger, we definitely are on a drive to get even more stakeholders engaging with the Central Drug Authority. And the stakeholders that we're talking about are the people on the ground that are implementing interventions. We've got NGOs that we are still not yet engaging with. We are on a drive to get them in. And in terms of the religious leaders and traditional leaders, the Central Drug Authority is very actively supporting the National House of Traditional and Christian Leaders. And the House has developed its own drug demand reduction plan. And just as we are having this engagement with the Select Committee, the House is engaging with all stakeholders that are implementing interventions in all the areas that are governed by traditional leaders at the same time. So we are very much involved in that. We do acknowledge that in terms of the religious leaders, the religious sector, and not just just one religious formation, but all of them, we are getting on a drive to bring them in as well. And what is the other question that was asked by Honorable Chirwa is how much does the Department of Social Development and other departments what are they using the funds for, the prevention funds for? I think the DM has mentioned that. It's a question that could be asked of the departments themselves. We do not have an idea of how much exactly has been used for prevention. And the measures that have been implemented to get the sorting out of how we stop the CDA using money, the stopping of the CDA using money, that is a question that I think is best placed with the department, not necessarily the CDA, and perhaps the DM will be able to answer that when it comes to answering in writing. The summit, we did have a summit in 2023. I think perhaps we are not very clear on that one. So the last summit that we had in the country was in 2011. And at that time, this current CDA was not the CDA that was operating. It was the third CDA. And they had that summit. And then when we came into office in 2021, we were advised that the last summit that had been held was in 2011. And then we immediately started working on ensuring that a summit happens in the 2 years since we entered office. So that happened in 2023. And because a summit has to happen every 2 years, we have to have another one this year before we finish our term of office, which finishes in March 2026. I think the other ones have been answered. Working with the USA, the Coalition on Synthetic Drug Threats was established in the term of the Biden presidency. And now that there's been a change of guard in the US, we have not actually been seeing a lot of activity regarding this coalition. However, we are continuing as a country and regarding substance use to engage with the entities that we're working with already. And we are hopeful that once there has been some kind of a change that is definite, they will advise us of that, and in particular advise the Department of Social Development of how then that engagement will continue. And the consideration of the 7 goals and how they impact drug use, we are trusting that the next drug master plan, which is under development, will consider all the issues that have been raised by provincial dialogues as well as by the summit and as well as all the entities that we have engaged. The issue of the provincial liquor boards, the regulation regarding liquor boards is a bit of a challenge currently because the regulation is not the same. So each province has its own regulations and they amend that regulation as they see fit. As I indicated, the Eastern Cape Liquor Board has recently amended its regulations, and now there is a change which started beginning of March 2025. I think, Chair, there's been an answering of every other question looking at my notes. Thank you very much. I'll hand over back to you.
Thank you very much, Deputy Chair. So I will request then the CDA to respond in writing in 7 days, especially the questions that need more details. Then I want to say thank you to the Deputy Minister, officials of the department, as well as the CDA for the presentation, as well as the responses to the questions of the honorable members.
Chairperson?
Yes, Isabella.
Thank you very much. I'm sorry, I'm not supposed to be raising a hand, especially after my principal has spoken. But just want to remind the chairperson that earlier on we talked about the director was supposed to respond to one area from the department, just to indicate that he has been on the platform, he's still on the platform. The problem was with connectivity, so I'm not sure as to whether this issue is being closed, it will be considered next time, or whether he still has to say something. That's what I wanted to say. But to say, I really concur with DM that and the chairperson that some of the issues that relate to us as the department will respond in writing, and CDA will be coordinating all the responses. Thank you, Chairperson.
Thank you, Isabella. I will request the director to send us that unit's report so that we as members can submit written questions to on this report, because we are out of time at the moment.
Thank you,
So,
Chair. Thank you very much.
thank you very much, DM, with your team, as well as the CDA, for your responses to our questions. We really appreciate it, and we will make sure that we have enough time when you come again. So thank you very much. You, DM, you and the team is excused because we must proceed with our meeting. Honorable members, we can see that we have another item on the agenda, and is our oversight report. So, honorable members, we have received, I think it's 3 weeks now that we have received this oversight report. Is there any inputs from your side as the members, or is there anything on the report that you want to discuss, because we must be aware of our time? Honorable members. Am I audible, honorable members?
Yes, you are, Chairperson.
So is there no discussions? Then we can adopt our report. Honorable Fanny.
No, thanks, Honorable Chair. No, my limitation on the matter, Chair, is that I was not part of the oversight. However, I've gone through the report, so I'm limited on those bases. Hence, I'm not responding, Chair. I thought that the honorable members who were physically there at least would have managed to can be able to assist as we are all correctly raising it.
Thank you, Honorable Fanny, but I think the report is very comprehensive. That is why honorable members is not responding in terms of the report. Honorable members, can we then move for the adoption of the report? Honorable members, especially Honorable Adrianse, Honorable Duplessis, Honorable Aris, Honorable Sibande, as well as Honorable Mokwele. You were part of the oversight. So can I get the move for the adoption of the report? Honorable members, are you still there?
Thank you, Honourable Chairperson. I went through the report and as I'm on the move at the moment, I made notes, but yes, it's quite an extensive report. And I find it comprehensive, but there are some notes that I made that I would like to have submitted, but I haven't submitted it before the meeting. And in absolute honesty, I don't want to adopt it, move to the adoption as such. So that's why I'm not very responsive at the moment.
All right. So I think, thank you, Honorable Adrian. So Honorable Pet, Honorable Sibande, your hand is
Thank you,
up.
Chairperson. I move for the adoption of the report. Thank you.
Thank you. But the other members is not responding. And Honorable Adrian have requested that the report must be not adopted. So we are now in a predicament. So I will request then that Honorable Sibande that we let the report be discussed on next week, on the meeting of next week, if it's fine with you.
No, ma'am. You see what we can do? It can be adopted with amendments if there are any. Unfortunately, they are not being submitted yet. It can be
Yes,
adopted with amendments. Yes.
yeah, I do understand that, Honorable Sibande, but the issue is there's no one that is adopting it. It's seconding your proposal.
Myself, I was adopting it. The
Yes,
only thing was
you move for it to be adopted, but
okay.
I need
Okay.
most now a second. Yeah, I need a
Okay.
second.
Thanks.
Yeah, Honorable Sibande. So we will let it stand over till next week, and we will only have 15 minutes to discuss this report, honorable members, and I will request Honorable Adriaanse to submit the amendments beforehand, Honorable Adriaanse. So without any delay, and I know some of our members need to rush to the Parliament, I just want to thank each and every one of you. Marcel, the minutes of the meeting will also stand over till next week. I know we need to adopt it, but let us give it another week.
Yes, Chair, we can defer that. Thank you, Chair.
Thank you very much, Marcel. So thank you very much, honorable members. Thank you, Marcel, and your team. We really appreciate your time as well as the time of the members. The meeting stands adjourned.
Thank you, Chair.
Thank you, Chairperson. See you
Thank you,
later.
honorable. See you.
Dankie, dame.
Dankie, Honorable Sibande. See you.